Thanks, Chris. And I'm here with Dr. Nita Bajor. She's a family physician with Oakview Medical Associates in Greenville. So thank you so much for joining us today.
Welcome.
And we want to discuss intermittent fasting. It's a type of fasting that's becoming really popular. And I'm sure a lot of people are wondering what it is and is it right for them? So what can you tell us?
So obesity is a chronic disease, and it basically is 42% of the United States adults have obesity. Intermittent fasting is basically time restricted eating. So having a period of time where you eat and then another period that you don't eat. And it creates a caloric deficit, which helps cause the weight loss.
Now, does it get you into that state where you're burning the fat?
Yes, it does help burn fat, but if you don't do it correctly under the guidance of a physician or a good provider, then what happens is you can lose muscle mass as well.
That's what I was wondering. I know sometimes you get into a state where you're burning muscle instead of fat. So you have to do it correctly. How do you do it correctly?
So there are various methods. A simple method is a 16-8, where you can choose a 16-hour block that you can fast. You can aim up to it, so 7 p.m. to 11 a.m. for example. But if you're not used to fasting, you don't want to start that, you can start 7 or 8 p.m. to 8 a.m. and then stretch it out to 9 a.m., 10 a.m. and 11 a.m. So that would be the fasting. And then 11 to 8 would be the period that you eat. So that's, or 11 to 7. So that's one of the easy methods. Another one is called 5 and 2, where 5 days you eat normally and then 2 days, non-consecutive days, you can fast during those days. And then there's another extreme one where you can eat and fast. Choose a whole day, 24-hour fast. But we do not recommend this without talking to your physicians.
Yeah, I think it'd be hard to work if I went 24 hours. So how effective is this at helping you lose weight?
It's extremely effective in weight loss. What it does is it creates that caloric deficit, which then helps burn fat. It lowers insulin resistance, so it helps with diabetics, bring your glucose down. It also is anti-inflammatory. So if you think about it, with Heart Health Month this month, it actually helps lower our cholesterol. It helps improve the blood pressure. But the key is when you're eating, you want to eat nutrient-dense foods, so you do not cause any micronutrient deficiency.
Do you think this goes back to kind of the old days when, you know, we were more hunters and gatherers, and you naturally went through these periods, these long periods where you did not eat because you had to go seek out your food, or you had to go make your food. So, yeah, do you think this is kind of going back to our origins of diet?
Absolutely, it is. So intermittent fasting, you know, although it sounds like it's a new fad, a lot of religions, a lot of ancient communities did it way back as a method of just cleansing their body, detoxing their body, because when you don't eat, you give your cells rest, and if your gut gets rest, then it's able to heal and able to really bring out new cells and you know, also prevent cancer. There's some good benefits there.
Now, are there any cons to this diet, or is anyone that should not take it?
Yeah, absolutely. It is hard to do, so it's not for everybody. That's one. Also, sometimes there can be a tendency to overeat in that 8-hour window, because you know, okay, that's my time to eat. I've fasted, and then you'll just go and eat anything. So you really want to plan your meals for the eating window. Also, it can cause, you know, people that have mental health or obsessive compulsive or eating disorders, if they do extremes of fasting, it can really be dangerous to their health. So you want to make sure that you do it in a guided approach, you know.
All right, make sure to go see your doctor before you start the intermittent fasting plan. All right, thank you so much, Dr. Bajor.
You're welcome. Thank you.